The Lagos State Accountability Mechanism for Maternal, Newborn, Child and Adolescent Health, LASAM 4MNCAR, tracks stockout of essential life-saving commodities biannually since the year 2015 and producing scorecards with the evidence showing about 65% of stockout in public health facilities in 2015. This situation limited the delivery of quality MNCH services to save lives of pregnant mothers and their children. The public health include 74 primary health care centers, 23 general hospitals and 1 teaching hospital offering maternal, newborn, child and adolescent health MNCH services. In addressing the gaps to improve the availability of the essential life-saving commodities for better quality of care at the public health facilities, based on the evidence by LASA M4MNCAH, a stakeholder mapping to identify the policy stakeholders and decision makers who could effect the positive changes we want to see in the facilities. These include the Honorable Commissioner for Health, Permanent Secretaries of Ministry of Health and Primary Healthcare Board, Director Pharmaceutical Services in both Ministry of Health and Primary Healthcare Board, Local Government Monitoring and Evaluation Officers, Facility Record Officers, Facility Pharmacy Technicians, and MNCAH Program Officers. The stockout scorecard produced biannually contains acts developed based on the evidence presented by the scorecards and follow-up inquiries in interrogating the bottlenecks within the health system. The asks are the solutions recommended for the stakeholders to act upon to bring about the desired change. The asks proposed include the following. The Lagos State Ministry of Health, MOH, and the Primary Healthcare Board, PHCB, should ensure availability of essential life-saving commodities in primary, secondary, and tertiary health facilities offering maternal and child health service, include budget item for the procurement and distribution of commodities in the MOH and PHCB budget, Directorates of Pharmaceutical Services in MOH and PHCB should improve commodity logistics management. Facility record officers of the public health facilities should monitor stockout data in order to improve data rendition on availability of life-saving commodities from public health facilities to the state DHIS2 platform. The Lagos State Ministry of Health should institutionalize drug revolving fund mechanism in all its public health facilities to improve availability of the stock of the essential life-saving commodities. This stockout scorecard produced biannually by LASA M4MNCAH is an essential advocacy tool that is being used to engage the relevant policy stakeholders in the health sector through scorecard dissemination meetings and one-on-one advocacy visits as the year rolled by. We also leverage on the regular meeting of the LGA M&E officer to share the scorecard data. The scorecard is also disseminated to the media, health reporters and journalists in the media roundtable. The media interrogates the data from these facilities and writes objective stories using both the traditional and the social media to reach the relevant stakeholders so they can take actions to improve the health system. It is worthy to note that our sustained advocacy efforts on improving the stock level of the essential life-saving commodities in the Lagos public health facilities since 2015 yielded a loud result that we celebrate today. We also need to note that the target PHCs has now increased to 78. The general hospitals are now 24 with the 1 tertiary hospital. The state MOH now have budget item for commodity procurement and last mile distribution. Reproductive health commodities allocation increased from 50 million naira 100 in 2019 to 227 million naira in 2020, a 454% increase. The pharmacy technicians are now the ones mandated to fill stockout data for the HMIS forms. The PHCB M&E Directorate now monitors stockout data monthly and it is improved data quality. All the secondary health facilities now have drug revolving fund mechanism. The comprehensive health centers also have drug revolving fund mechanisms. When LASAM 4MN CAH developed the year 2020 stockout scorecard, no public health facility reported stockout. It was zero stockout. On this note, Advocacy continues to sustain the gains of this great feat in Lagos State.